I am Michelle Jane Sevilla, a student nurse from Davao Doctors College, and today I am going to perform obtaining of vital signs. Accurate measurement of vital signs is critical because it reflects the body's basic functioning. It serves as a baseline data which allows us to track the changes in patient's condition, recognize early patient deterioration, and prevent harm or errors that may occur. Vital signs include temperature, pulse rate, respiration rate, and blood pressure. So before conducting the procedure, make sure to prepare all the paraphernalia needed. First, digital auxiliary or thermometer for patient's body temperature, stethoscope, and sphygmomanometer to measure patient's blood pressure, and a watch with a swift second hand to measure patient's pulse rate and respiration rate, cotton balls, tissue, TPR sheet, and of course an alcohol for disinfection and to avoid contamination. So now I am going to start by taking my patient's body temperature. The temperature is very important because it reflects the balance between the heat produced and heat loss of the body. And there are a few sites in which we could obtain its measurement from. It could be through oral, temporal, rectal, axillary, or through the tympanic membrane. But for today, I am going to take my patient's body temperature through her axillary site. So prior to the conduct of the procedure, I am going to close the door to ensure my patient's privacy. And also, I am going to adjust the light and adjust the room temperature for my patient's comfort. And of course, I will perform hand hygiene to disinfect and avoid contamination. Okay, so now I am going to introduce myself to my patient and verify her identity and of course explain to her the procedure that I'm about to do. So good afternoon, ma'am. I am your student nurse for today. I'm Michelle Jane Sevilla, and I will be taking your body temperature through your axillary site or through under your armpit. Is it okay with you, ma'am?
Yes.
May I see your wrist, please? Please state your name and your birthday.
I am Gazame A. Sevilla and my birthday is on August 1, 2006.
Okay, thank you very much. And now I am going to rinse the thermometer by using an alcohol swab and a firm twisting motion from the stem to bulb. And now I am gonna pull up your sleeves, ma'am, so I can put the thermometer. So before I'm going to place it on the area, I'm gonna need first to take a look at it and see if there are any scars or lesions and pat dry if the area is wet or moist. This is because moisture in the axilla may alter the result of the temperature. Okay, so ma'am, can you please raise your hand for me, please? Okay, so now we are just gonna have to wait for a minute or up until the thermometer beeps, which indicates that it has already obtained the body temperature of the patient. So after we obtain the result, I am gonna need to inform the patient of the result of her temperature and of course, disinfect the thermometer with an alcohol swab from the stem to probe. So, thank you so much, ma'am. Your temperature is at 36.3, which is within the normal range. And now I will perform hand hygiene. This is all to deter the spread of microorganisms, and I will recheck the temperature if the temperature is obviously too high, too low, or inconsistent with the clients. This is to prevent an incorrect temperature reading. But since the temperature of the client is normal, then we're not going to recheck. And then I will document the temperature in the client's record, for example, the TPR sheet. Okay, now I am going to proceed to taking my patient's pulse rate. The pulse is a wave of blood created by the contraction of the left ventricles of the heart, and in order for me to measure it, I am going to need to do palpation on the pulse side of the patient, which could be through her temporal, carotid, apical, brachial, radial, femoral, popliteal, tibial, and her dorsalis pedis. But today I am going to be palpating for her radial pulse because it is the easiest and the most accessible pulse site. So prior to the conduct of the procedure, I am going to close the door to ensure my patient's privacy. And also I am going to adjust the light and adjust the room temperature for my patient's comfort. And of course, I have to perform hand hygiene to disinfect and avoid contamination. Okay, so now I am going to introduce myself to my patient and verify her identity and of course explain to her the procedure that I'm about to do. So good afternoon, ma'am. I am Michelle Jane Sevilla, your student nurse for today, and I will be taking your pulse rate. So is it okay with you, ma'am?
Yes.
May I see your hand, please? Or your wrist. So please state your name and your birthday.
I am A. Sevilla and my birthday is on August 1, 2006.
Okay, thank you very much. So now I am gonna assist for your pulse rate, and so can you give me your hand, please? Okay, so now to locate the radial artery or for the radial pulse, I'm gonna need to use these 3 fingers of my hands, and so I'll just have to trace her thumb and place my fingers in this area of her wrist and feel for the pulse. And it is important to note that aside from the number of beats per minute to count, I also need to check for the strength of her pulse, which is graded on a 0 to 3 plus scale. 0 being the pulse is absent, 1 plus if it is weak, 2 plus for normal, and 3 plus if it is bounding. And of course, I also need to check for its rhythm, if it is regular or irregular. Okay, so ma'am, I have found her radial pulse and I'm going to start counting the beats per minute. Okay, ma'am, your pulse rate is at 72 beats per minute and it is graded 2 plus, or which means it is normal and it has a regular rhythm. So after doing this procedure, I'm gonna have to do a hand hygiene and of course document the data that I have gathered in her TPR sheet. Now I am going to be measuring my patient's respiration rate. So the respiration rate is simply the number of breathing a person takes in a minute. It is usually done when the person is at rest and by just simply counting the number of rising of the chest of the patient. So prior to the conduct of the procedure, I am going to close the door to ensure my patient's privacy. And also, I am going to adjust the light and adjust the room temperature for my patient's comfort. And of course, perform hand hygiene to disinfect and avoid contamination. Okay, so now I am going to introduce myself to my patient and verify her identity and of course explain to her the procedure that I'm about to do. So good afternoon, ma'am. I am Michelle Jane Sevilla, your student nurse for today, and I will be taking your respiration rate. Is it okay with you, ma'am?
Yes.
So may I see your wrist, ma'am? Please state your name and your birthday.
I am A. Sevilla and my birthday is on August 1, 2006.
Thank you very much. And now, ma'am, I just need you to be at ease and be relaxed. So for counting the respiration rate, I am not only simply counting for the number of breaths she takes, but also for the depth of her breathing, if it is labored or unlabored, and for the rhythm, if it is regular or irregular, and for the character. And it is important to know that one rise and one fall of the chest would be equivalent to one respiration rate. So ma'am, please put your hand here. And now I am going to take your respiration rate. Okay, so ma'am, your respiration rate is at 16 breaths per minute and it is within the normal range and it has a regular rhythm and a labor. So after doing the procedure, I then need to do the hand hygiene and of course document the respiratory rate and her TPR sheet. Okay, so now I am going to be measuring for her fourth vital sign, which is the blood pressure. So the blood pressure is the pressure of the circulating blood against the walls of the arteries, and it could be obtained with the use of stethoscope and a sphygmomanometer. So prior to the conduct of the procedure, I am going to close the door to ensure my patient's privacy. And also, I am going to adjust the light and adjust the room temperature for my patient's comfort. And of course, perform hand hygiene to disinfect and avoid contamination. So now I am going to introduce myself to my patient and verify her identity, and of course explain to her the procedure that I'm about to do. So, good afternoon, ma'am. I am Michelle Jane Sevilla, your student nurse for today, and I will be taking your blood pressure. Is it okay with you, ma'am?
Yes.
Can you please give me your hand and please state your name and your birthday?
I am May A. Sevilla and my birthday is on August 1, 2006.
Okay, thank you very much. So prior to the conduct of the procedure, I have already checked for my equipment if they are clean and that they are well functioning. I also have the correct size of the cuff that I'm gonna need for my patient, and of course inspected my patient if she has any injuries, cast bandages, blood transfusions, or any arteriovenous fistula which could be hinder me from taking her blood pressure in a particular limb. And after that, I will also make sure that the client has not smoked a cigarette, ingested beverages that contains caffeine, or has had any strenuous activity within 30 minutes. So ma'am, have you taken a cigarette and caffeine?
No.
And have you done any strenuous activity?
No.
Okay, thank you. So then I will determine the best site or arm to use. So ma'am, can I ask you what is your dominant hand?
My dominant hand is the right hand.
Okay, so it is best to take blood pressure on the non-dominant hand, which is the left if the patient is right-handed. So since the patient is sitting, I'm gonna need to make sure that both of her feet are on the ground because the blood pressure increases if the legs are crossed. And I'm gonna have to place her arm at the heart level because if the arm is at the lower level, then it would give us a higher blood pressure reading, and if the arm is at the higher level than the heart, then it would give us a low blood pressure reading. And then I will expose her upper arm. So ma'am, please put your hand here. And then I will place the cuff so that the inflatable bag is centered and lies midway over the anterior surface of the brachial artery. It is because pressure applied directly to the artery will yield more accurate readings, and I will use my fingertips to feel a strong pulsation on the antecubital space so that the accurate blood pressure reading is possible when the stethoscope is directly over the artery. And now I'm gonna have to do a preliminary palpatory determination of her systolic pressure to avoid having a lower systolic reading by oscillatory method if there is an oscillatory gap. And now I'm gonna start inflating the cuff until I no longer feel the pulse of her brachial artery. So I'm gonna deflate the cuff, and after that I have already taken her estimated systolic pressure, which is at 114 millimeters of mercury. So for the actual taking of her blood pressure, I'm gonna need to inflate the cuff at about 30 millimeters of mercury, higher than the estimated systolic pressure, This is to ensure or to avoid missing the oscillatory gap, which is a temporary disappearance of the corrupt sound while deflating the cough. Okay, so for the actual procedure, I'm now gonna need to use my stethoscope, but first I'm gonna need to disinfect and the earpiece and the diaphragm and the bell of my stethoscope. So once I have found the brachial artery, I'm gonna need to inflate the cuff up until 142 mm of mercury and inflate the cuff, and the first sound that I have heard would be her systolic pressure, and for the dystolic number it would be the period of silence after the last sound that I have heard. And so since this is my patient's initial examination, I'm gonna need to do the procedure again. So again, since this is the initial procedure, I'm gonna do it again on her other arm. Okay, so first I'm gonna remove this one and do it on the other arm. Please move, ma'am. And move your hand.
Kumain yung pakoso na giring na.
Okay, so now I got your blood pressure, which is at 118/78 millimeters per mercury, so it is within a normal range. Okay, so thank you very much, ma'am. So since I have already her blood pressure, and after doing that procedure, I'm gonna need to fully deflate the cuff like what I did earlier, and wipe the cuff with disinfectant so as to reduce the risk of cross-contamination. And of course, I'm gonna need to do hand hygiene and plug the data that I have gathered in my patient's TPR sheet. And that would be all for my return demonstration of obtaining of vital signs. Thank you very much.